as your dentist will check your face, your neck, your jaw, your lymph nodes, your tongue, ask you to bite to see your biting strength, and check your cheeks, in addition to your teeth and your gums. A routine dental exam also involves oral cancer screening, and it's recommended that you visit your dentist for a routine exam every 6 months. Hi. To continue our discussion with routine medical testing, we've spoken about routine blood tests, routine imaging, routine physical exam, and routine pulmonary tests. So today we're going to be diving into the importance of routine bone density test, visual, hearing, and dental exams. Now, these screenings are crucial in maintaining overall health and well-being, and let's see why they are essential. Starting with the bone density test. So the bones in your body usually offer what is called structural support to your body and are integral to your overall health. But what happens as we age is that our bone density tends to naturally decrease, and this increases the risk of fractures or osteoporosis, which is weakness of the bones. So in order to get ahead of this and be proactive about this, we need to do routine bone density test or scanning, which are also called dual energy X-ray absorptiometry. Now, this usually entails passing rays through your bones to detect how your bone health is, what the level of osteoporosis that are setting, because as I stated earlier, your bones naturally decrease in strength as you get older. Now, this is really important because not only does your bone density become important as you age, it's also strongly recommended for postmenopausal women that are not taking estrogen. If you also have a personal or family history of any fractures, including hip fracture or femoral fracture. Now, femoral fracture is your thigh. The biggest bone in the body is called the femur. So if that breaks, that's the femoral fracture. Now, if you have a family history of that type of fracture, or you use medications that are known to cause bone loss, which include corticosteroids, or if you also have a personal or family history of thyroid conditions, which is hyperthyroidism. Now, the thyroid is located here on your neck. Now, when they produce hormones, hypothyroidism is when the production of those hormones are excessive. Now, behind the thyroid is your parathyroid. So if both of them are affected excessively, that is hyperthyroidism or hyperparathyroidism, there are many chronic medical disorders that can cause your bones to be brittle or more likely to break. These are essentially called risk factors. We have conditions such as diabetes, which we've already stated before, liver disease, which is if the cells of your liver are not working as they should, kidney disease, that's if when your kidneys are not able to flush out unwanted waste. You can get more information as we discussed about a routine blood test as to how we know how your liver is working appropriately and how your kidneys are working appropriately. Now, whenever you have this personal or family history of these conditions, make sure to inform your healthcare provider, inform your doctor, especially if you have some situations like if you had recently had a barium examination or if you had been injected with a contrast material for a scan. Now, once you have done these things, you might have to wait 10 to 14 days before doing this DXA test. And also, you should inform your doctor if you are pregnant. Bone density tests are very quick and are painless. They can be done once every 2 years or as advised by your doctor due to your health condition. Moving on from bone, we also have to check our eyes and our ears. Our eyes and our ears are very essential senses that allow us to interact with the world around us. So routine eye exams and routine ear exams are very well indicated. They can help check changes in vision and hearing. Especially with hearing, in this day and age, a lot of ear instruments are used to listen to music or to listen to videos. So due to that influx of sound directly into your earbuds, the need for hearing test is very crucial. And also to check your eyes. A lot of us look through screens of our phones or screens of the television very consistently over a long period of time. So checking your eyes will be very beneficial. For checking of eyes, we have something called the visual acuity, which checks your range of eyes. You've heard something that people usually call 20/20 vision. That's where the visual acuity comes in, because it diagnoses common conditions that would affect your vision, especially things like nearsightedness. Maybe you can't see things that are close to you clearly. That's usually called myopia. We also have farsightedness, where you cannot see things that are far ahead of you very clearly. We have color blindness, where people perceive colors like green as brown, or cannot perceive the color black or the color red. We also have astigmatism, where your eyes cannot see clearly if affected by light sources directly. Now, the imaging of your inner eye can be done by optometrists to detect these problems that have been stated earlier. Now, not only is your vision affected by different external factors like light that I said before, or looking at your phones, or stressing your eyes to read in the middle of the night with poor light sources. Age can also affect your eyes. Now, the way age affects your eyes is, as you age, there's something in your eye called the aqueous humor. The aqueous humor is what waters your eyes, makes your eyes as fresh as they can be, watering it every time. It's also where your tears come out from. Now, when you age, that water, that aqueous humor, reduces in amount. So when it reduces in amount, it can cause cloudiness of your eyes. Now, that cloudiness of your eyes is where we get the cataracts. Also, we have glaucoma, which is also related to having cloudiness of the eye. Now, how often do you want to get your eyes checked? Now, depending on your age or your medical condition, it is paramount to check once or twice every year. Now, for adults younger than 40, you can check every 5 to 10 years. And for adults between 40 to 54, you can check every 2 to 4 years. Adults older than 55, check every 1 to 3 years. Now, you might need to check your eyes more than this, especially if, for instance, if you have diabetes or if you are hypertensive, because you need to check if those conditions have not caused a complication that has affected your eyes. Now, when you check your eyes more often, and especially if you wear glasses or contacts, if you notice that they are causing you headaches, you might need to change the lens that you have, just so you are in the right path in terms of getting your eyes checked. Now, for hearing tests, these are not one-time events. And I know hearing tests are not typically done universally across Nigeria as frequently as is needed. But in this day and age where listening mediums and listening devices are very, very common, as you age and the changes are abound, you would need to do this test, especially for people older than 50. You need to do this test every 3 to 5 years. People 60 and above, you have to do it every year, as a lot of people in this day and age are exposed to loud noises. And finally, we have to talk about dental exams. Oral health is very linked to your overall health, and poor oral hygiene can lead to different systemic infections and conditions. So a routine dental exam is very good to help detect these oral issues ahead of time. We eat a lot of meals, a lot of oily meals, a lot of candy, a lot of things that will cause cavities or gum disease early. Now, we want to make sure that we have timely treatment and preventive care for these things. A lot of oral health is taken with a pinch of salt because it's not something that you can visualize except it causes pain. So that's why I would advise you go for a dental checkup before it gets to that point. As your dentist will check your face, your neck, your jaw, your lymph nodes, your tongue, ask you to bite to see your biting strength and check your cheeks, in addition to your teeth and your gums. A routine dental exam also involves oral cancer screening, and it's recommended that you visit your dentist for a routine exam every 6 months. All these tests are very important. They cannot be overstated. A bone density exam, hearing exams, your visual exams, all very important, and they provide valuable insight to various aspects of your health that early detection would be beneficial. Please be proactive and make sure to maintain this health and well-being by prioritizing proactive and preventive care and participate in all routine medical screening. And that brings us to the end of another episode of Seco Direct. I remain your host, Dr. Tiwa. As I've stated before, if you have any questions or you have any comments, please reach out to us and I'll be sure to let you know. Thank you very much again. Until next time, take care and stay well.